You're watching Eyewitness Newsmakers.
And now joining us at Newsmakers, the individual who runs this hospital, Antoinette Smith Epps, who since 2005 has been the administrator of Martin Luther King Jr. Harbor Hospital. We say good morning to you. You oversee a budget of $300 million, 1,500 employees. The first and most important question I can ask you this morning is the hospital open and operating, and what services are you providing?
Yes, the hospital is open. We are operating. We are available to provide emergency services of all types for people who require those. We see about 120 patients a day in our emergency department and our urgent care centers. We have about 70 clinics that are open and operating that see over 2,000 patients a week in those clinics.
Clinics such as AIDS?
We have an AIDS clinic. As a matter of fact, in March, we opened a new AIDS center for our services, our outpatient services there. We also have oncology clinics, pediatric clinics, OBGYN clinics. We have ophthalmology, ENT, urology, most any service that you might need, we have at King Hospital. We operate about 48 inpatient beds at this current time, hoping once we pass our regulatory requirements that we'll open back up to 120 inpatient beds by November of 2007.
You actually have the capacity for over 200 beds.
Yes, we do.
Now, the second and perhaps most important question is state health regulators in the past week said that the hospital should close and they're taking steps to revoke your operating license. A 32-page report citing findings from between October of 2004 and June, just this last month of 2007. They said that the hospital failed to ensure the competency of its nurses and the protection of its patients. What was your reaction to it? What's the hospital going to do about this?
We received what they call a notice of accusation. We have 15 days to request a hearing to contest that accusation. We intend to contest it. We don't believe that that report reflects the full story of everything that's been done to improve services and to maintain quality services at King Hospital. And what our intention is to do is to prove to both the state and federal regulators that we have indeed improved our services and are providing quality services to our patients.
While you are then going to follow this response for the state regulators, you in fact are preparing, if not have already had a visit by federal regulators who also can withhold funding, and they can stop that right away. There is no appeals process. Once in August they issue their findings.
Right. The final, our final deadline, if you will, for CMS compliance with the conditions of participation is August 15th, 2007. And by that time, we need to have satisfied the federal regulators that we meet all of the conditions of participation, or we will face them revoking our certification.
What do you think should happen now?
I think that we should be prepared all the time to serve our patients with the very best quality care that we have. Our obligation as patient advocates is to provide to our patients the very best care to the fullest extent of all of our resources. If for some reason we don't have the resources that are necessary to treat that particular patient, then our obligation is to, as quickly as possible, identify the appropriate resource, whether that be within the county or elsewhere, and move that patient to that appropriate level of care as quickly as possible.
Do you expect the hospital should be able to stay open?
Yes, I do. I wouldn't be here if I didn't think that.
You walked into this job right in the middle of all this. You came in 2005. We're talking about citations back to 2004. Certainly we hear about the Edith Isabel Rodriguez story and other cases. Do you maintain that's an anomaly then compared to what kind of care most other patients would receive? So how did that happen?
Unfortunately, healthcare workers are like any workers. And sometimes they don't pay full attention to some of the things that they ought to be doing. One of our goals is to have multiple redundant systems.
You're watching Eyewitness Newsmakers.
Now we have another important perspective on the future of King Harbor Hospital. We have two voices from the community. Lita Heron is the president of the Youth Advocacy Coalition, And Eddie Jones is president of the Los Angeles Civil Rights Association. He actively protested the hospital's downsizing. I want to ask the first question for both of you to address. What would the hospital's closure mean?
It's a full service facility. It includes a medical school. It includes a medical magnet school. It's a training facility. It has a health service building. It has a specialty unit that covers eye care and things of that nature. So it's not just a hospital, it's a full service complex that we're concerned about losing. Access to that arena, as too many of us understand and that live in that community, is limited, if non-existent. So to lose that, it's much more than just patient care.
And Mr. Jones, though, if it were to be lost, at least as far as the county's operation is concerned, but regained again under a different operator, a private operator, would that be harmful?
No, that wouldn't be good. I would like for the County Board of Supervisors to continue to fight to keep the hospital open. There are a lot of people that live in that community and that need Martin Luther King Hospital. Now, we must remember that Martin Luther King came after the riots. And after the riots in 1965 came Martin Luther King Hospital, where Mr. King himself and Mr. Hahn walked through there and touched every window and every door and blessed that hospital to serve the community in its full capacity. To have that hospital closed in any manner would be a sad day in America.
But you have repeated studies saying that the patients are being served poorly there. Is it helping anyone to give them substandard care, as it has been alleged?
I disagree with that. I was the chaplain there for 4.5 years. Martin Luther King actually saved my father's life when he went into full cardiac arrest. I've gone to Martin Luther King several times myself to see what's going on. I've been in there. I talked to the doctors. I talked to different people that work there. They do a good job. They don't talk about the good work that Martin Luther King does.
That's right.
That's Ms. Heron, I wanted to ask you. Do you think the cases of Edith Isabel Rodriguez and other patients who have come to the fore are out of the ordinary for what you've seen as the work there?
Well, you know, Ms. Rodriguez's case is an absolute horrific event that occurred. There is no explanation, there is no excuse for it. And we believe that the speedy response from the new administration in dealing with the staff was excellent, actually, and that's the response we expected them to have.
So once again, getting back to, do you think that by and large the care that we don't hear about is better than we think?
Yes, I do. See, because Mr. Jones and Dr. Hutchinson and I have actually gone to the site. We spent several days out there speaking to everybody from staff to patients, and all of the patients to a last man were in agreement that they appreciated the services. We had a candlelight vigil last night, and one of our mothers who lost her child to gang violence brought her son there, and she is absolutely assured the hospital did everything they could to save her child. She has no question about that at all. And even though he did pass on, she's assured. And so many that we spoke to people there last night that gave story after story of how this hospital helped them where they had no choice to go anywhere else.
And not only that, we remember all the testimonies that we received from patients, patients with cancer, patients with AIDS, patients with leukemia, glaucoma.
Would you both agree, though, in our final minute, though, that staff could be better there?
Yes.
Well, I think that they're fixing that problem as we speak.
They are.
They are making sure that everyone in there is adequate in what they do, professional in what they do, and that they have an apprenticeship to make sure that they can give the fullest and best health care that they can possibly give to any and everyone that comes there for help.
And the evidence to support that it can be fixed is that they passed their last federal inspection. So that shows that the changes, the fixing that we ask for, mend it, don't end it, which is what the phrase that Dr. Hutchinson coined, is proof that good hands given by this current administration can make the difference. That's all we've ever asked for, to fix the hospital, don't close it.
All right, Lita Heron and Eddie Jones, we want to thank you for joining us. We'll speak to you again as soon as we find out what happens to the hospital and where we go from here. Thank you for joining us today.
Thank you for the opportunity.
Thanks. And stay with us. We'll take a look at the week ahead and tell you a few stories that are sure to make headlines. Thank you. That was the fastest 5 minutes.